Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I got a great episode that we are pulling out of the vault. This is a Hall of Fame episode. That means it is one of our top 10 most popular podcast episodes that we've ever had. That means a lot on this show. And so, guys, this is a great one with Dr. Anna McManamey, or Dr. Mack as she is called. We are talking about a 4-year-old male neutered domestic shorthair who has a systolic heart murmur and who's scheduled for a dental. How worried about this should we be? Do we blow it off and just do the dental? Is this a reschedule thing? Do we need to refer this away? What do we say to the owners about the risks? Guys, you're wondering, I see these cases and I stop and go, oh, am I about to make a good choice? That's why this episode is a Hall of Famer. It's great. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast. Welcome back to the podcast, Dr. Mack. Thanks for being here.
Thank you for having me.
Oh man, I enjoy having you on the podcast. I'm so glad you're back. Let me pause and introduce you to those who don't know. You are a professor of cardiology at Purdue's College of Veterinary Medicine and a lecturer and a genuinely wonderful, smart person and a great darn teacher. And so that's why I hope that you would be able to help me out with this case.
Happy to be here. It sounds so fancy when you say it that way.
I know. I get introduced and people are like, this is Andy and he has this big title. And I'm like, that sounds really fancy.
I don't know if I'm qualified. Yeah. Because I know.
I'm like, boy, I hope they don't ask me hard questions.
Yeah.
Because I can't justify
I'm a newbie
title.
cardiologist, but I'm enthusiastic. So
no, I think you're amazing. I love having you on the podcast. I have a kitty cat that I need help with. And again, maybe this is just my personal bias. Maybe it's just the ratio of dogs to cats that we tend to see in practice. Maybe it's just sort of the secretive nature of cats. Maybe it's that cats are a little bit harder to physically examine than dogs sometimes. I don't feel like I find a lot of heart murmurs in cats relative to heart murmurs in dogs. But I got one. I have a 4-year-old male neutered domestic shorthair named Alabaster, who came in for a dental cleaning, and he's got a heart murmur. He's got a grade 2, maybe a grade 3. I'm not the best at nailing exactly. He's in the grade 2-3 range. Yeah, just a systolic heart murmur. No complaints from the owners. He's not, he doesn't seem to be coughing or anything. I asked him, is he coughing? And they're like, not more than usual. And so that usual, like, okay. Yeah. So it's that. Yeah. So I'm looking at this cat. One is an anesthesia patient, but then also number 2 is just a general maintenance of a fairly young cat that I had not heard a heart murmur in before. Dr. Mack, how do you treat that? Where do you go with this case?
Yeah, I think it's a great question. This is a very common scenario of why a lot of cats come to see me, honestly. I think you hit a lot of good points right off the bat. Cats are sneaky. Cats, they hide their disease. They don't usually act sick even when they are sick. And then there's a very frustrating, ratio of the number of cats that have heart murmurs that actually have heart disease and vice versa. So when you hear a murmur in a cat, I'd say it's a 50-50 chance that they have structural heart disease. So still a reasonable chance that they do have that structural heart disease that you need to further investigate before putting them under anesthesia, where they're going to get fluids as part of their anesthetic protocol. So in cats, a murmur usually is from some type of outflow tract obstruction. So whether that's like an HOCM, so hypertrophic obstructive cardiomyopathy, or some type of less pathologic form, a dynamic right ventricular outflow tract obstruction. But usually that's where we see these murmurs in these younger cats. Mitral valve disease really isn't common in cats. It happens in really older cats, like geriatric kind of cats. But in this young of an animal, I think it's very appropriate. It's a male cat. It's a middle-aged cat, domestic short hair. Those are animals that are predisposed to HCM and structural heart disease. So what are you going to do with it? Well, I think if this were a dog, the answer would be easy. Take a set of baseline chest x-rays, know what you're dealing with. Unfortunately, in cats, because their heart disease they get most commonly is a hypertrophic cardiomyopathy, it's a concentric thickening of the ventricle. So the ventricle thickens inward. And so taking x-rays on a cat, their heart can look miraculously normal, even if they have significant disease. So I say that an X-ray is helpful for ruling out severe heart disease, maybe. But honestly, if you see a big heart, they probably have heart disease. If you see a normal looking heart, they still could have heart disease. So
like 50-50 chance they could have heart disease.
It's frustrating, right? Because you got this cat, you want to do the dental, it's asymptomatic.
This is much less helpful than I thought.
So I still think x-rays are okay. I think that, again, if you see a big heart on x-rays, then I'd say, well, you probably do have heart disease. If I see a normal heart on x-rays, it just doesn't rule out heart disease. So X-ray is not wrong to do. The other thing that's growing in popularity that I actually really like is something called the BNP. So this is the B-tide natriuretic peptide. So this is a biomarker. It is very, very specific for the heart. And what it tells us is if the heart is stretched. So it doesn't tell us what the heart disease is. It doesn't matter if it's even primary heart disease. It could be like in an older cat, could be hyperthyroid heart disease, could be systemic hypertensive heart disease. But what it tells us is the ventricles are under some type of duress. They're either having a pressure overload or a volume overload. Something's going on. And this is a blood test. It's usually always going to be sent out. Like IDEX is the one that owns this test currently. So it's going to be a turnaround. So it's not going to be same day results, but it's a simple blood test. You can do it with their pre-anesthetic blood work, for example. It goes out. The range for cats is pretty tight. It's about 0 to 100, kind of picomole per liter per deciliter is the range. And usually if it's in that range, I don't worry at all about any type of structural heart disease. It's outside that range. It's a pretty sensitive test. So you might get cats that have false positives, meaning it's a little bit outside the range, but their hearts look very normal echocardiographically. But that's a good screening test, in my opinion. It's better than maybe even x-rays, just because, again, you can have pretty severe heart disease, but a normal heart on x-rays. So the BNP, in my opinion, is the cheap man's echo. Like it's, and if you can't get to a cardiologist right away, or you don't have the money to get to a cardiologist, then a BNP is a very appropriate screening tool. And I'm looking for that number to be higher than 100.
Do you add that in as like a routine screening test for patients you're planning to put under anesthesia? Is it that level of screening tool utility, or are you still thinking mostly I have questions or concerns about I add this onto? I'm just curious, like how Are you just sending these out all day long?
I know.
Or
this is a slippery
targeted
slope. I'd say I'm definitely in the
and you're a cardiologist too. You're like, you're asking the wrong guy.
But I do. I think I realize that not everyone can come see me, right? Like we see, totally. It's going to sound really bad when I tell you how many cases I see. It's not enough, but I don't have enough time to see all these cats. And so what are we going to do in the meantime? But I do think that the BNP in the cat, not so much the dog, but in the cat, I think it's appropriate to start screening cats, just like you do for hyperthyroidism. Like there's enough cats that don't have heart murmurs that have heart disease. And so wouldn't it be nice if we could catch them earlier to just let the client know what's going on with their pet, what they need to watch out for with their pet? Is there any medication their pet should be on before congestive heart failure or something happens? So I might make some people mad when I say that, but I think it's, I think it's a good enough test that it might be worth doing more often.
I mean, at what age do you start to think about screening for things like this, right? Because it is a measurement of sort of the state of the heart. So it seems like screening kittens is probably not going to be super productive or really insightful for the future. But I mean, are you talking about 5-year-old cats? Are you talking about 8-year-old? Is this a senior wellness type of screen in your mind? I'm just curious, kind of when you look in your crystal ball, kind of where do you see that going, or how do you use that tool in your toolbox?
Yeah, first of all, highly recommend a crystal ball to every veterinarian because they do come in very, very handy.
Well, mine has been craptastic for the last 3-4 years. It's just boy,
I wish I had one of those. But yeah, I think that's a great question. So I would say, if you look at HCM, hypertrophic cardiomyopathy, as a model of heart disease, because it's the most common heart disease we see in cats, it's usually around 5 to 8 years of age where that kind of takes its peak effect in cats. However, we see some cats as young as 3. So I think 5 seems like a magic number for me. I think maybe 3 is a little early, but you could catch some that are starting to show signs earlier. But I'd say as early as 5, but I think kind of at 8 years of age, when you're starting to screen for hyperthyroidism, it's probably appropriate to be doing the same for the heart.
Talk to me a little bit about blood pressure in these cats. Is that going to be an insightful tool when I've got this sort of heart murmur? Yeah. I mean, is that something it didn't come immediately to hand, I guess, when we talked about chest x-rays and we talked about the BNP.
Yeah.
Is there real value in trying to get this cat calmed down in a nice secluded place and try to get a good blood pressure? And what can I gain from that?
Yeah, that's a great question. So I usually will reserve the blood pressure. I think it's a very important test, but I usually will keep it for a little bit later in the lifespan of the cat. So it's unlikely that the cat at this age, at 5 years of age, is going to have systemic hypertension. However, that's a very cheap, very accessible test to do because, again, if your BNP is high, you're kind of obligated to check a systemic blood pressure and to check a thyroid level. Again, even though it's unlikely in a cat that young, if those two diseases are present, whether that's systemic hypertension or hyperthyroidism, both of those conditions cause a thick left ventricle, would cause an elevated BNP. So definitely has its place. Again, in that age range, I'd be less suspicious of it, but totally appropriate to do.
Let's talk about management of heart disease in cats. And I think that's something that probably compliance and adherence are often a bit of a challenge. It's hard, especially if we have ongoing medications for these cats. How do you introduce the idea of long-term medication to pet owners? What sort of pearls of advice do you have for setting pet owners for success?
Yeah, it's a great question. And I think with cats, it's just a whole nother level of difficulty than compared to dogs. Yeah. You'll get the occasional cat that just eats everything you put in front of them, but that's not always going to be the case. So the good news is that cats with heart disease, again, HCM being the most common, really the only medication that we routinely recommend in these guys before congestive heart failure happens is a blood thinner. And Plavix, clopidogrel, we do think is probably better than just aspirin for preventing that thromboembolic event. That's that big, scary thing that we really want to be able to just let clients know their cat has a risk for it. I would say a lot of ATEs, aortic thromboembolism that I see, unfortunately, it's the first time the owner ever knew their cat had disease. So that's the one that we're trying to protect them with. And so really the left atrium has to be big for them to be at that risk. In most cases, I'll say like less than 5% of cats that have ATEs have a normal left atrium size. So most of the time their left atrium's big. If they have a high BNP, if I would say probably at least over 200 BNP range, if we echo them and they have a big left atrium, blood thinner is what we're prioritizing in terms of treatment. It's a once a day therapy. It's a small pill. So those things are in our favor. Once heart failure happens, congestive failure happens, then it's furosemide and their Plavix, plus or minus an ACE inhibitor. We don't have that same evidence that it has to have that ACE inhibitor to have a better prognosis once congestive heart failure happens, like we do in dogs. Does it make sense that they would do better? Yeah, it makes sense, but we don't have that exact evidence. So if congestive heart failure happens and I have a cat that the client can't medicate well, I'm just going to prioritize what I need to give them. And that's their Lasix, which is a small pill. And that's their Plavix or some type of blood thinner to try to reduce that risk of an ATE. I have cats that are on injectable drugs. They're on injectable Lasix because the owner can't medicate them. So it's kind of like a diabetic cat in that stance. So we're just giving injections of Lasix twice a day instead of giving oral medications. You can coat the meds in some butter. You can coat them in cottage cheese, those kinds of tricks. But unfortunately, at least not yet, are like transdermal medications. I think that would be a godsend if we could get some bioavailable transdermal Plavix or transdermal Lasix, something like that for these kind of cats.
No success in that regard so far.
Not yet.
I've heard people mention pimobendin in cats.
Yeah.
That's kind of one of those back alley.
Yeah. I was listening to one of your podcasts with Dr. Journey and she was like, it's the religion debate, right? So yeah. So I would say that for the asymptomatic cat, so the cat that's not in congestive heart failure, there's probably no cardiologist that's going to recommend pimobendin in those cats. So different than dogs. If there is a cat with congestive heart failure, some cardiologists might start pimobendin in those cats. The rule for me is if there is a murmur, don't give the pimobendin because pimobendin worsens dynamic obstruction. So if you already have a heart murmur, odds are it's dynamic obstruction. Giving pimobendan will worsen that obstruction. So that's kind of my general rule. If there's a murmur and heart failure in the cat, just don't give Pimo. Just stick with your Lasix, your Plavix, plus or minus your ACE inhibitor.
That's super useful. Thank you for walking through this with me. Are there any final pearls, words of wisdom, or pitfalls I should look out for just in general dealing with heart disease in a cat?
Yeah, I think something that you actually mentioned in part of the history was coughing in cats. Coughing in the cat rarely is from heart disease, rarely is from congestive heart failure. I'd say the only times they see cats coughing with congestive heart failure is if they have a significant amount of pleural effusion or a significant amount of pericardial effusion, which are both presentations of left-sided congestive heart failure in the cat. So the coughing cat with a murmur, to me, I actually move heart failure way down on my list and prioritize other things. The other little tidbit I'll leave you with is if you're in the ER setting and you tap a cat's chest, do a thoracocentesis, and you just want to know, is this heart failure or not? You can run that sample on a BNP test. So you don't even have to use the blood. And there's these BNP tests, the B-type natriuretic peptide tests that are SNAP tests that are available for the ER setting. It just tells you, is it normal? Is it abnormal? That's a same day test. It's SNAP. It's 8 minutes, but you can run that on blood, serum, or the pleural effusion, and you actually get a pretty good result with that.
That is super useful. Awesome. Thank you. Thanks for sharing. I'll tell you real quick. I remember being a first year veterinarian, and I had a cat that had a chest full of fluid, and I was going to tap it, and the owner was there, and I was getting ready to do it. And he said, "How many of these have you done before?" And I was like, I wish you hadn't asked me that. And then I was like, I'm going to be honest. And I'm like, none, but I've read about them. And he was like, is there someone else who could do this? And I had to go get it. I did. I went, the most humbling experience.
Oh my gosh.
But
that happened. That still happens to me. They're like, how many have you done? And the devil on my shoulder wants to say, whether it's 1 or 100, I'm all you got. Show your violence.
Yeah, you're exactly right. Yeah. And just for me, I worked at a big practice. There were like literally a dozen other vets, and they were like, "Why don't you get somebody else, Junior?" That's whenever I start to tap a cat's chest. A cat's chest. I think, how many of these have I done? It's like, oh, a dozen. Okay, But oh man, that's funny. But yeah. Well, the other thing too, you did a rotating internship. You did an emergency critical care internship. And then you did a residency. There's probably not a whole lot that you haven't done once.
At least
already.
Once, yeah, so. It's always a little humbling, and you're kind of like, how do I answer that?
I do. I've been doing vet medicine for 13 years, and I am humbled every day. And I go in there and go, oh well, I love it. We always. I think if it wasn't that way, I think it might get boring.
I agree.
And it's vet medicine's a lot of things.
Never boring.
Boring's not one of them. Thank you, my friend. Thanks for being here.
My pleasure. Thank you.
And that's what I got, guys. I hope you enjoyed it. It is a Hall of Fame episode from Dr. Mack. Thanks for being here. Take care, everybody. We'll talk to you later.